How many people here listening to me today know how to perform CPR? According to the Cleveland Clinic, only about half of Americans know how to perform CPR. Of that amount, more than half are unaware of the correct pace and proper technique to perform high-quality CPR. CPR stands for cardiopulmonary resuscitation. According to the American Heart Association, CPR is an emergency life-saving procedure performed when the heart stops beating. The action of chest compressions helps mimic the heartbeat, bringing circulation back to the body. What we will discuss today are the techniques of delivery of high-quality adult CPR and infant CPR. The first step in any medical emergency is to secure the area. This can take anywhere from seconds to a few minutes, depending on the situation, so it's important to know what to look for. There are 3 basic rules when assessing the scene for safety. First, secure the scene. Are there hazards that can be removed? Does the area need to be evacuated? Second, if hazards cannot be removed, the scene needs to be evacuated. Remove all persons immediately to an area that is secure and safe. Third, once everyone is safe, now is the time to call 911 and ensure that EMS services are on the way. According to 911.gov, the 911 dispatcher will want to know the following information: location of the emergency, contact information in case of phone disconnection, the nature of the emergency. In this case, the person affected is most likely unconscious and not breathing. The following details: how many people were affected, description of the scene, and any other medically relevant information. Now that help is on the way, it's time to assess the victim. You probably already know by now whether the victim is breathing or not, as the 911 dispatcher most likely asked that question. However, if not, it's time to check for whether the victim is breathing. Assess the victim. If they are unconscious, check for breathing by watching for chest rise and fall. If not detectable, lean down and place an ear to the victim's mouth and assess if you can feel or hear an exhale. Check inside the mouth and around the neck for any obstructions and remove them if possible. If the patient is not breathing, it is time to perform CPR. Steps to adult CPR as discussed by the American Red Cross. Place the patient on a firm and flat surface to ensure that proper depth of compressions can be achieved. Begin compressions. Kneel beside the patient. Make a fist and place it midline to victim's chest, and cover fist with your other hand. Give 30 compressions at a rate of 100 beats per minute. Also ensure a depth of at least 2 inches. Let the chest fully rebound in between each compression. Give breaths. Ensure the victim's head is tilted back so to not block the airway. Pinch the nostrils shut with the other hand. Take a breath and place your mouth completely over the victim's mouth to create a seal. Exhale into mouth. Watch for chest rise and fall to make certain breaths are being done correctly. If you do not see chest movement, try again by adjusting the chin up and head back. Breathe into mouth again 2 times. Continue to look for chest rise and fall with every round of breaths. Repeat 30 chest compressions and alternate with 2 breaths until EMS services arrives. No matter what happens, do not stop your life-saving efforts. Maintaining circulation is key. Now that we've discussed adult CPR, let's go over infant CPR. One of the most important things about child and infant CPR is gaining permission from the parent or guardian if possible. If there isn't a guardian around, consent is implied, meaning it is legally safe to perform. Secure the area. Follow the same 3 rules as previously discussed. Are there hazards that can be removed? Does the area need to be evacuated? Evacuate if needed. And third, call 911. As discussed before, the dispatch will want to know the following information: location of the emergency, contact information, and the nature of the emergency. Steps to infant CPR according to the American Red Cross. Position baby onto a flat and firm surface. Begin compressions. Place thumbs side by side midline to baby's chest, just below the nipple line. Use remaining fingers to circle around baby's back. Give 30 compressions at a rate of 100 beats per minute and ensure a depth of at least 1.5 inches. Let the chest fully rebound in between each compression. Give breaths. Ensure that the victim's head is tilted back so to not block the airway, and pinch the nose shut with the other hand. Take a breath and create a seal around baby's mouth with your own. Exhale into mouth for 1 second. Watch for chest rise. If you do not see movement, try again by adjusting the chin up and the head back. Breathe into mouth again. Continue to look for chest rise and fall with every round of compressions. No matter what happens, do not stop your life-saving efforts. Maintaining circulation is key to sustaining life and preventing brain damage. Now that you have learned the steps of CPR, I hope that you have the confidence to complete the steps on your own. I encourage you to learn CPR fluently. By knowing how to perform high-quality CPR, the victim has a much higher chance of survival. You never know when you might need to save a life.